we get asked all the time, as the conversation was earlier today, earlier this morning around, creating, rolling out new services for 988 and other sorts of things, and all the different challenges, workforce challenges, etc. And we have to try to provide a new service and get people to do new things. And we're often faced with a lot of challenges around, especially technology and how to support them. So we end up cobbling together, a mix of Microsoft Excel, maybe SharePoint, text message, even email, paper forms, surveys, etc., to be able to kind of cobble something together ourselves. And we do the best we can, but it can, it's not ideal. It can create a lot of frustration and a lot of time extended to kind of roll out these services. So, I've seen this, for a number of years now. It's pretty common. And can there be another way? And that's really what we try to do with Chorus, right? So let's take best in breed kind of platform, user experience, design, beautiful templates, beautiful ways that people can experience these tools, and make it so it really is adaptable. Some companies that have pre-made solutions, they'll try to make it adaptable, but when you talk to them, you want a button on this page, then they got to work it into their roadmap, and maybe a year later, maybe it gets changed, and it can cause a lot of frustration. Whereas here, there's modules that are out of the box, ready to go, so you can start in a matter of weeks and get rolling with your services. That's really critical, but it leaves open the possibility to actually adapt the modules in a lot of flexible ways, and I'll show you some examples of that, to really adapt the services as you need. And it could be like, great, you have a dispatch for field teams for crisis management. Perfect, that module works for us, but we need it to be changed like this. And oh, by the way, we have this whole other service that it works in a very different way. Then we can create modules for that and have everything talk to each other and be integrated. So I think that's really exciting and very kind of different than how we might have experienced technology in the past in terms of either purchasing something off the shelf, or choosing between that, or having to like create something from scratch. This is sort of the best of both of those worlds. So Chorus platform in the middle to really drive a lot of the ability to do this quickly, connecting with EHRs. So we can connect with NetSmart or Cerner or Epic or whatever it is that people are using, and then develop and deploy these applications out into the field and for various staff members. The big difference here and the benefit, is the how rapid things can change. So you all are asked to roll these services out ASAP. The technology can keep up with that, and in fact help facilitate those things. We mentioned workforce, creating tools that help them get onboarded quickly, to help support and provide the guardrails and the guides as they need throughout the day, etc. And then we talked about it being not limiting, so it can really grow with you as lessons are learned and you need to adapt services or spin up new services. All that's possible. And of course, compliance is a big a central focus here too. So with the platform, we can go through full security risk assessments once, and then make changes without having to redo that. And you can spin up new modules without having to go through the full risk assessment over and over and over, which can add months and months to roll out. All right, so let's go through some demos quickly. And let's start with the Behavioral Health Hub. And as it's most related to the topic of this call, being 988 and the related kind of services there. So we created this largely, working with Orange County and others to support a lot of the different services that they needed. And it's built on the Chorus platform, as you can see. And then we can support both resource navigation at the bottom in blue, so self-serve, people public facing, go to the site, and I'll show you that. This is the OC Navigator here for that, so we'll come back to that. But also support internal workflows like case management, real-time bed availability, tracking, field teams, and of course on the other end, outcome reporting, etc. And this is a great example too of this participatory process and how powerful it can be within organizations, large or small. We started out in Orange County as an example with the resource navigation, the public-facing resource navigator. And then when we created that, the county was like, oh, great, we did that, awesome. So, well, now actually they need to connect with our services, the OC Links 24/7 line, their warm line. Okay, so then we created a module for that. And then they were like, great, well, now the warm line dispatches the field teams, and then the field teams need to take people to the beds, the like crisis stabilization units, etc., and so on and so forth. So we're able to kind of walk through in a organic way and support really digital transformation throughout the organization. Here's an example of some of the screenshots I'll walk you through, but case and client management, mobile team dispatch, so out in the field, there's GPS tracking available, etc. Staff scheduling was another one. So the ability to, who's on what shift is a big challenge actually, and especially when we have all these different teams and matching who's available to which case is a big burden. So that was another area to help with, and then the real-time bed availability. So real quick, just walking through some of the screens for the core dashboard, and all this can be configured and changed based on what you need. But we can see here at the bottom, all the recent cases that might have come in for management and dispatch. Over on the top right would be like follow-up reminders. So I'm a dispatcher. I need to follow up on certain cases. That's all easy for me to kind of manage. There's other views of the cases where I can see and drill down and search for specific individuals or for specific cases. And then when it comes to case management, there's a number of different details that can be entered here. But this is focusing on the dispatch tab. So this is a case where a case can result in a field team being dispatched, like a mobile crisis team. And you could see here that there's different statuses, and then the individual can walk through the different statuses over time as the individual goes through the case. So they're dispatched, they arrive on scene, they start the assessment, they end, they're cleared, they're ready for the next case. And there's additional details that people can enter about the case as well. As an example of the adaptability, we didn't have progress notes before. One of the organizations we worked with really needed that to have people in the field write some basic notes, and that was able to be added quickly. So you click this and you can write a note. We even adapted it so that there's like additional note types, etc. So a lot that can be done, and then this can all get synced back into the EHR to avoid duplicate data entry as well, but provide the staff the kind of flexible, adapted interface that's mobile friendly, works well out in the field, can take advantage of like things like dictation and other sorts of tools within mobile phones, etc., to really make that job a lot easier. So it's another example of the technology adapting to the workforce and supporting them where they're at. Okay, so then being able to find and search for resources and refer out in the field or at the home office and associate those with the cases, etc. And of course, the individual view, this is all, there's client profiles, and we can see the case history over time to provide additional context. And then additional information can be synced from the EHR if needed. But a lot of organizations are really focused around the practical workflow kind of history and information that would live within Chorus and in this this application. Again, connecting to where workflows are. So one organization had operators available on the web via live chat. So there's a chat interface that's created within Chorus. You could see the individuals can start a conversation, and then the operator here can click and create a case from this chat and launch the whole workflow you saw above from there. One of the areas we're really excited about that a lot of people really like is this dispatch dashboard. So imagine individuals out in the field and being able to track exactly where everyone is. So this is on the bottom, each column represents the different statuses, and individuals can move across those statuses as the case progresses. And then on the top right is a map of where everyone is and where all the cases are. So you can easily see that, as a central person managing this. And you can click on these cards and then see some additional details. They're zoomed in here because the cards on the screen are a little small. But again, this can be adapted to include whatever we want on these cards. But being able to kind of get a bird's eye view, an operational view around what's going on, and this could be used for real-time crisis cases, like cases that are happening within the next several hours, or views like this can be created for long-term follow-up. There's outreach teams that can take several weeks to follow up, and these columns and statuses can be adapted to that. So a lot of opportunity there. Out in the field, having a mobile-friendly interface for the teams to quickly see the key information about what's assigned to them, update the statuses, get all the information they need, and then enter whatever information that they might need to do out in the field as well. Again, all kind of adaptable to what might be needed. And here you can see the chat. So there's actually an embedded chat within the case. So as the person is entering updates in the app, it's automatically inserting updates into that history. But it's also used by staff members to actually write individual status updates about what's going on. So I'm waiting for law enforcement to arrive, should be another 10 minutes, etc. And the individuals in the home office can see that and always stay in the loop without having to use outside messaging services, etc. And then it's an opportunity to have a documented thread of what's happening when, that lives with that case and can always be referenced later as well. The real-time bed availability, I won't go into this much here, but if others are interested, please reach out. Happy to walk through, but you can assign beds and have a streamlined intake process. This was where the primary need here was the different CSUs were getting referrals from all these different places, and nobody knew who was reviewing which referral. So this is a centralized referral system and a census tracking and ability to manage the beds all kind of into one, which really improved a lot of their workflows. And of course, kind of coming back to the outcomes reporting and dashboarding, again, all reports that can be updated based on what's needed, but it's a really important part, and this should be adaptable too. So we also support the ability to export the data. So if you use an external, analytics like, to visualize your data or analyze your data, that's all supported as well. I mentioned the staff scheduling before too, and this is an example here of one of the screenshots for that. So you can see we have different teams and different individuals on different teams and shifts, and the colors represent different roles, and we can easily kind of determine who's on which shift and manage that, because that's also part of the challenge and the workforce availability and matching the right individuals to the right needs at the right time. So another possibility there. I'll show here the OC Navigator. This is the public-facing version, and again, we did this actually through a community-partnered participatory design approach. So we actually had a number of stakeholders throughout the county representing different individuals, cultures, communities, and everything was informed by them. The color, the look and feel, the illustrations, a friendly, approachable way to look for the resources that I need. It started out with local service resources, and we actually recently added digital resources, so apps, online video, toolkits, things like that. So a real difference from like a traditional, yellow book kind of white pages resource directory kind of approach. But you could still also use it for that. So you can click a category, for example, mental wellness, and then we have curated resource guides, which I'll show you, as well as the ability to kind of search and find different resources that you might be looking for. Let me show you really quick the resource guides. So again, this is another area, doing it in a partnered way with stakeholders. What they said is that it's great to search for resources, but we have a lot of lists, and there's a lot of lists that are curated for specific scenarios. And could this provide an easier and alternative way to find things that are kind of tailored more towards me? So for example, working with OMID, a local organization, assistance for refugees. So refugees assistance, it's across the social determinants of health. And you can see that it's a really interesting mix of resources that would be hard to find if you were searching for it from like just a category way. So here we have social support services and particular ones that might be relevant to this community, legal services, mental health providers, but again, specific kinds of mental health providers that may be helpful, employment support, etc. So it's a lens and it's a view to creating and navigating that. It's reflecting the wisdom of the community through the technology. And that's another benefit of this participatory approach. Start with out-of-the-box modules for common workflows, etc., but listen and adapt so that the local wisdom, whether it's within service organizations or out in the community, can be reflected. Another, I think, real innovation is the depth and level of multi-language support. So here we could see the site completely translated in Arabic. We have a whole translation portal that can be entered, so that way you can support not just auto translations, but also manual translations. And this really helps people feel welcome, so that it's not just a literal translation, but it can be culturally adapted, but auto translated where that's feasible and appropriate as well. And finally, the other example, Together for Wellness. So this is through the Department of Healthcare Services in California. Kind of a similar look. This is fully around digital resources, again, done through a partner process with a bunch of different kinds of stakeholders throughout the state. But this started out at the beginning of COVID, the need to quickly spin up something to support digital resources for mental health, for like loss and grief, or family well-being, etc. And there's different topics here, and it really kind of supports it's a reflection of quickly adapting to changing needs out in the world, and having the technology follow suit and support them in that. All right, so just to wrap up, this is one of my favorite quotes from one of the stakeholders within a large public health agency, where she said, difficult to use technology is actually worsening the workforce constraints. People don't want to come to work in an environment where tools are burdensome and dry. And at the same time, creating tools that are beautiful and easy to use creates a positive, appreciative environment. And importantly, moves the focus from the process and paperwork back to helping individuals. And that's really our mission and our goal, is to facilitate the change in the world, the improvement in people's lives, by getting the technology to enhance the services and get the right people back and focused on helping, because that's what we're all here for, and as well. And I personally, I feel technology can and should be beautiful. It should be easy to use, it should be beautiful, it should add to our day, and it's about democratizing that aspect of design too. It's not just about the forms and the elements on the page only, so we can take the whole person's experience into view.